Hello, I'm Dr. Talley. I'm the Chief Medical Advisor here at Spero CBD. I was just logging on today. We're going to be starting a series about every 2 weeks or so, some question and answer sessions, where we're hoping to provide you with some educational CBD content that's succinct and easily digestible without too many technical terms. So I'll introduce myself a little bit. I'm a Johns Hopkins trained, board certified physician anesthesiologist. Um, I had obtained a master's degree as well in physiology and biophysics from Georgetown University. I'm currently in private practice anesthesia. The thing that drew me to CBD was the fact that during our time in anesthesia residency, we take care of patients for both acute as well as chronic pain management. And on my pain management rotations and training, we would get questions regarding CBD. So that's really what drew me into CBD. So before we get started, I always have to start by saying, before starting CBD, make sure that you check with your physician or healthcare provider ahead of time, just to make sure that it is in fact safe and it works with any other medications you might be taking or health conditions you might have. So today we're going to look at 5 common questions regarding CBD. So to get started, let's take a look at how long does it take for CBD to start working. This is a pretty common question, and it's really a 2-part answer. So the first part is, depending on the route of administration, you will start to notice immediate effects within about 15 to 30 minutes. However, you do have a build-up phase where once you start taking the correct dose of the CBD daily and consistently for about a week or so, you should start to notice more of the full benefits of the CBD. You will see that about 15 minutes after taking CBD oil sublingually or under the tongue, you will notice effects. And then when you take a capsule by mouth where the CBD oil is actually contained within the capsule itself, that takes time to be digested and absorbed through your GI system. So that can take closer to 30 minutes. Another question here, second question is, does CBD oil actually do anything? So with CBD, just like with anything, it's going to affect everybody differently. As you may or may not know, people have what's called the endocannabinoid system already in our own bodies, and CBD helps to optimize that system. So depending on how well your own system is working, the CBD might alter it differently and have a different effect on your body. So you will likely notice, those that do receive a benefit will see things like an elevation in mood, ability to alleviate their stress, reduced inflammation, and likely promoting better quality sleep for them. So that brings us into number 3, which kind of ties into our second question there. How does CBD oil make you feel? Well, as I was saying before, everybody's a little bit different, but for the most part, people will experience some of the things I mentioned, the benefits above. However, time of day as well as dosing can have an effect. So you might take the same substance, the same CBD product. However, during the earlier part of the day, when you may have just woken up and have energy, you might notice that the CBD gives you a relaxation or a calmness. Not sedating, it shouldn't make you too drowsy, but just something that helps you kind of relax, forget a little bit about the daily stresses that you see. Later in the day, however, you might notice that your CBD dose makes you relaxed enough to help you fall asleep, which is mostly because at the end of the day you're already tired and your circadian rhythm has changed. So at the end of the day, the CBD is really just trying to help promote the sleep cycle that you already have in place. So even though you're taking the same product you did in the morning, it might have a different effect on your body later in the day. So our next question that we'll cover right now is, how do you know if CBD is working? So as we kind of talked about, you will notice the effects, positive effects, within about 15 to 30 minutes. And as I was touching on earlier, because of the build-on effect, or the fact that CBD does need a little bit of time to accumulate with a consistent dosing, you will start to see the full effects about a week, maybe 2 weeks out. Now, you can't just say, I've been taking CBD for 4 or 5 days now and I'm not noticing any effect. That's got to be about a week or 2 of the correct dose for you. So that brings us to our next question, number 5, and our final question for today. What happens if CBD doesn't work? So that really ties in because you might be underdosing the CBD for yourself. Most people will find success somewhere between 10 to 30 milligrams of CBD up to every 6 hours a day, and you'll get great benefits from that. But you do need to find the right dose. So the way to find the right dose for you is if you're getting benefits from it and you're not having any side effects, that's the perfect dose for you. If you don't notice any effects with your starting dose, you might need to slowly increase your dose every 5 to 7 days to see what dose starts to give you the positive effects. If at any point, though, you start to notice significant side effects, which are relatively rare but can happen, such as nausea, irritability, things like that, then you might want to decrease your dose back to where it was. And then occasionally, CBD might not work for you. Either you can increase your dose and you might not get a benefit, or increasing your dose starts to give you these side effects before you start to appreciate a benefit. However, CBD does seem to be rather safe for most individuals, so giving it a try and seeing how well it works for you, you should find that you will receive a benefit in most situations. However, I don't want to sit here and say that CBD will work for everybody all the time. There will be people, just like with any other supplement you might find or anything else in life, you will see that it's not going to work for everybody. So I just think that people shouldn't give up on CBD if they have recently started it and don't see a benefit, as you might need to adjust the dosing on that. Something else that might help would be taking a form of CBD that has higher bioavailability. And what that means is the amount of the CBD that actually makes it into your bloodstream. We touched a little bit on this earlier with how quickly the sublingual or CBD under your tongue works. That has high bioavailability because a large portion of the CBD that you put under your tongue goes straight into the bloodstream and can go to work giving you the benefits. Taking the capsules by mouth, while still effective, they take a little longer to kick in, and they go through what's called the first pass effect in the liver, where as things are absorbed through your GI system, your intestines there, they have to be processed by your liver. And sometimes when that happens, the amount of the CBD that makes it into circulation that's going to work for you has been decreased. So those are the two things to make sure when you're starting out taking CBD is, one, finding the right dose for you and then consistently taking it for about a week or two to notice the full effects, and two, make sure you're taking a product with high bioavailability, so that way you're actually getting the CBD that is claimed to be in the product that you see in front of you. So that concludes our short live session, question answer session for us today. Now make sure you try and tune in. We're going to try and do a live session like this every 2 weeks or so, and as we gain more interest, we might increase that frequency, and I'll be happy to take questions on CBD now, but also in the future. 2 weeks from now, we'll talk about sublingual CBD administration. So if you know the topic ahead of time and you have questions, I'll try my best to answer things live, and if I miss your question, we'll try and reach back out to you at a later time to give you the information that you would like. So I'll stay on here a little bit longer, see if any questions pop up regarding things we've touched on or CBD in general. Otherwise, I'll tell you all to have a great day, and thanks for tuning in and stay healthy. I'm going to scroll back through and see if I can see if there were any other questions here. So I do see one question not related to CBD. It's how can we invest? There was a crowdfunding, equity crowdfunding round done on startengine.com. Our chief executive officer, David Alred, would be able to reach out to you with more information regarding this and how you could get more involved with investing in Spero CBD. But we appreciate the question. Looks like most people are waving. I'll send a wave out to everybody who has waved to me. It's kind of hard to go through. There's quite a few of you, so it's hard to individually do that. But I do appreciate everybody joining me today. I haven't seen any other questions, so I'm going to go ahead and log off. But if you could think of a question later, please feel free to reach out to us on here or at the next live session, which will hopefully be in about 2 weeks or so. And also, please check out sperocbd.com. There's plenty of resources on there if you're interested in learning more about CBD and looking at the products there as well. But by all means, I like these question and answer sessions to be short and succinct to provide you with quality educational content. So feel free to join me next time, and I'll see you then. Thanks.